My name is Michael Garabato and welcome to the Seeking Safety Group Facilitator Training course. This is the first introduction and the first lecture, so basically I just want to go over an overview of what you're going to get out of this course. First, you're going to get a comprehensive understanding and full working knowledge of seeking safety and all of its 25 lectures. If you're new to seeking safety, this is what the book looks like. It's a treatment for PTSD and substance use, co-occurring disorders, using cognitive behavior therapy. B, you have the ability to plan, prep, improv, and facilitate seeking safety groups. Cultural competencies will be explained. When I talk about cultural competencies, I'm talking about the different demographics of clients that we work with in this type of work, whether you are a social worker or a therapist or a peer advocate. We work with all types of different populations, and these groups need to be individualized for those types of populations, whether it would be you're working with court-ordered clients in a outpatient, or you're working with in-custody clients doing seeking safety where they're already in crisis, so there's a whole nother dynamic to that as well, and multiple other levels that I will cover. Next, D, we'll talk about trauma-informed care. Obviously with PTSD, you want to have a trauma-informed care approach, and with seeking safety, there's a case management component built into the book, so I think with trauma-informed care, it just adds a little bit more to the treatment. Next, CBT, I'll do a full overview of CBT and just the basics of it in case you're not familiar with cognitive behavior therapy. It's the main tool that you'll be using in the book. PTSD, post-traumatic stress disorder. PTSD is a mental health diagnosis that's found to be commonly running co-occurrently with substance abuse disorders, which is why they created the Seeking Safety course. Treatment plan goals, case notes, medical billing. Treatment plan goals. If you are working in any type of a medical billing situation, or you are using ASAM, you're working an outpatient, things like that, and you are doing case notes, sometimes you have to do specific case notes for the groups for medical billing, where you will need to individually write a note for everyone in the group, know their treatment goal that's actually in their treatment plan, in their chart, and then write in that note the intervention that you used to help facilitate bringing the client closer to achieving their treatment plan goal. I'll talk about a few of those things and little tips that I have for you. Next, H, we'll talk about motivational interviewing, how to use it individually and in group, and I'll give you a rough overview of that as well. Substance use and abuse, we'll talk about that and the general basics of it. I'll have an updated Q&A where you can ask me any type of questions you want, or we'll go over it, or I may add new segments or lectures depending on the need. Community, I'll be offering a Facebook community where you can go on there and chat with other Seeking Safety Group Facilitators, and it is the Seeking Safety Group Facilitator group. Downloadables and custom overviews. I'll have a custom overview for all 25 groups with what I think you should use, because you'll notice in the Seeking Safety book that there will be maybe 18 different examples of different things you can use for each group, and it kind of gets overwhelming. I'll use the ones that I like to use for each group, so it's really easy and you can just start your groups right away. All right, I hope you like what I covered, and I'll see you in the next lecture.